Colleagues and friends, welcome to watch a snapshot of WHO Country of South Sudan achievements for the period of 2021 to 2023. This is a collaborative work, and as I said, it's just a snapshot of our work in collaboration with the Ministry of Health and the partners and donors in South Sudan.
South Sudan's first COVID-19 case was recorded in Juba in April 2020. The COVAX facility donated the first vaccine doses in March 2021. Since then, over 5 million people have been fully vaccinated with support from World Health Organization and other partners. Over 900,000 adults have been administered a booster dose, providing further protection against COVID-19. Vaccination coverage increased from 21.4% in October 2021 to 81.9% in January 2024, including 90% coverage in healthcare workers and almost 80% of the elderly being fully vaccinated. The COVID-19 vaccination uptake has achieved gender equity, with females comprising 51% and males comprising 49% of the vaccination population. To enhance vaccine uptake, reduce COVID-19 cases and fatalities, and promote global health, Mr. Ted Chaiban, the global lead coordinator for the COVID-19 Vaccine Delivery Partnership, visited South Sudan to support the country in increasing vaccine coverage, focusing on high-risk groups such as healthcare workers, the elderly, and those with comorbidities. He met with government officials, development partners, communities, religious leaders, and other stakeholders to strengthen collaboration in the COVID-19 response. WHO supported South Sudan's Ministry of Health in fighting COVID-19 by setting up an oxygen plant at Juba Teaching Hospital. The project includes constructing a facility to house the plant, providing 240 cylinders and 4 years of spare part kits. Local biomedical technicians and engineers received training to operate and maintain the plant, ensuring its sustainability. WHO also assisted in establishing a public health emergency operations center and donated vehicles to strengthen the health system's response to COVID-19 and other health emergencies. In addition, WHO supported the Ministry of Health in installing a polymerase chain reaction machine. During the response, intensive care unit beds, oxygen concentrators, and medical supplies were donated to healthcare facilities, further bolstering their capacity to provide quality care to needy patients. In 2023, South Sudan achieved a significant milestone by formalizing its One Health multi-sectoral coordination mechanism. Honorable Dr. Martin Elia Lomoro, Minister of Cabinet Affairs, and Honorable Yolanda Awel Deng, Minister of Health, officiated the event. The One Health multi-sectoral coordination mechanism is crucial in addressing zoonotic public health threats and environmental issues. WHO has supported the building of a modern medical waste management facility at Juba Teaching Hospital to collect, transport, and treat infectious waste and sharps. This marks a significant step towards ensuring a safe and healthy environment. Following the declaration of the Ebola outbreak in neighboring Uganda, South Sudan switched to preparedness mode to prevent the importation of the Ebola virus disease. WHO supported the Ministry of Health in setting up infectious diseases units in high-risk areas, including Nimule Border Point and Juba, to screen, isolate, and treat patients with infectious diseases, including Ebola. Senior officials from the Ministry of Health, WHO, and other partners visited the Nimule Port of Entry facility to assess the Ebola preparedness activities and strengthen the measures, including screening, surveillance, and contact tracing. WHO supported the establishment of a port health facility at Juba International Airport in South Sudan to improve coordination and communication and mitigate cross-border health risks. following the outbreak of armed conflict in the Sudan. Tens of thousands of people fleeing fighting crossed into South Sudan. WHO supported the Ministry of Health to scale up its operational readiness and response by deploying multidisciplinary teams of emergency responders to states experiencing high influx of population to ensure provision of much-needed health services. In the year 2023, the Emergency Preparedness and Response Team of WHO South Sudan was the well-deserved recipient of the Regional Directors Team Award. Despite operating in a highly challenging context marked by multiple shocks, the team's dedication and collaboration made it possible to save many lives and protect vulnerable populations from deadly diseases. The team also stood out in terms of how they communicated their work. South Sudan has maintained its wild polio-free status for the past 2 years. The country has not only sustained this achievement, but has also met the two crucial surveillance indicators across all administrative levels, covering 91% of its counties. This highlights the nation's strong and extensive commitment to preserving the progress made in the fight against polio in the country's health sector. It's worth noting that routine immunization has significantly improved, with an increase from 60% in 2020 to above 80% in the past 2 years. Furthermore, the measles follow-up campaign in 2022 was highly successful, reaching over 2 million children with measles vaccine, achieving 92% coverage, and other interventions like vitamin A and albendazole. Malaria remains the leading cause of illness and death in the country, accounting for 66.8% of outpatient consultations, 30% of admissions, and about 50% of deaths. To build on progress made in malaria control, South Sudan's Ministry of Health, with support from WHO and other partners, convened the first ever National Malaria Conference that took place from 8th to 10th November 2022 to call for multi-sectoral collaborative approaches toward targeted interventions to accelerate the reduction of malaria illness and deaths. Neglected tropical diseases pose a significant threat to the population of South Sudan, with over 12 million individuals at risk of infection, and need for prevention and treatment measures is paramount. The World Health Organization has supported the Ministry of Health in developing and implementing the NTD's master plan. WHO has also played a pivotal role in building the capacity of health workers across the country in various aspects of NTD's management, including drug provision, diagnosis, mapping, mass drug administration, active case search, and contact tracing. Since 2021, the concerted efforts have resulted in nearly 17 million individuals receiving treatment for river blindness, elephantiasis, bilharzia, trachoma, and soil-transmitted worms. In 2023, the Health Sector Strategic Plan 2023-2027 was launched to provide strategic direction for implementing the second phase of the National Health Policy 2016 to 2026. It outlines priorities, strategies, and interventions for delivering essential health services equitably, strengthening health systems, and achieving universal health coverage. The WHO Country Office is committed to fostering a culture of zero tolerance for sexual exploitation, abuse, and harassment. To achieve this, the office has established a strong preventing and responding to sexual exploitation, abuse, and harassment network and coordinated actions across its various programs and operations nationwide. In total, 110 in-person sessions were conducted directly, reaching over 6,000 people, including WHO and partner personnel and communities. Furthermore, WHO is co-chairing the National Interagency PSEA Task Force for 2 years, starting from March 2023. In April 2023, WHO celebrated its 75th anniversary. As part of the commemoration, the Ministry of Health hosted Walk the Talk in collaboration with WHO and the South Sudan Athletics Federation to promote health and prevent non-communicable diseases. Regular physical activity has significant health benefits. WHO organizes routine run or walk events to prevent non-communicable diseases. These goals focus on promoting well-being and ensuring healthy lives for all ages. In January 2023, WHO South Sudan held a 3-day staff retreat in Juba. The retreat aimed to reflect on the progress made by the office so far and explore ways to work better as a team to achieve the triple billion goals in South Sudan. At the year-end party in 2023, Dr. Fabian Ndenzako, the WHO representative for South Sudan, presented the Staff Association's award to Mama Pierina Vitale and Susan Aite, who are among the long-serving staff of the WHO South Sudan country office.
Let me take the opportunity to thank all of you for the collaborative work that we have done together, in particularly the Ministry of Health and donors and health sector partners that we have collaborated to realize the results that you have seen for the achievement of the universal health coverage in South Sudan.